Hello, hello. Welcome back to day three of Empowering Black Women with MS and Lupus. I'm Ashley Ratcliffe Lundy, the Director of Communications with We Are Ill and a fellow multiple sclerosis thriver, and I have the pleasure of moderating today's conversation. We've talked all things clinical with Ask the Doctors. We've talked mental health and emotions with group therapy yesterday, and today we get practical with Ask the Nurse. This is the session where we ask, between appointments, between flares, between the big stuff, how do I actually run my day? What do I track? When do I call somebody? What's a realistic care plan? What does a realistic care plan look like? Wanda Bagley is a registered nurse at the Shepherd Center, which means she has seen what works and what doesn't up close every day. She's going to keep it real with us. But before we dive in, I'd love to go over some housekeeping notes. Alrighty. So the good news is the session's being recorded. It'll be shared with you tomorrow and then it'll be on our YouTube channel. So if you miss anything, don't worry, you can go back and watch the replay. We want you to bring your specific questions, your day-to-day questions, and especially the ones that help you to better advocate for yourself. When you do have questions, we would love for you to enter them in the Q&A box. I'll ask them throughout, and there's also a dedicated Q&A segment at the end. Raise your hand if you want to get off, instead of typing, you want to ask it out loud. Cameras are optional, of course. The fact that you're here is enough. Next slide. And so just a couple ground rules so we get the most out of the hour. Wanda is sharing her nursing expertise, but not personalized medical advice. So don't share like all your specific results. Take that to your personal care team. And keep the questions general where possible. Don't ask like, now I'm on this. Can you refer me to this medication? Or I've heard about, that sort of thing. Just keep it general. Please be respectful. This is a shared space. And if you can, just type one question at a time, just so we can get to as many questions as possible. That'd be great. And don't be shy. Just bring all of your questions. We really want you to, feel comfortable enough to ask them. This is what this session is for. And we're pretty sure that somebody else in the room needs the answer to your question as well. So, alrighty. Now that we got that covered, let's dive in. Wanda,
Hi.
introduce yourself. Hi, thank you so much for joining us. Tell us about, your background, your role, what got you into nursing, all that good stuff.
Thank you for having me. Um, as Ashley said, I am a nurse at the Shepherd Center. I've been at Shepherd almost 25 years. Next year will be 25 years, which I can't believe it's been that long. I'm a native New Yorker, and my nursing career started there. And when I was in New York, I primarily worked a little bit of everything. I started off in psych, I did some med surge, and then I found myself working in adult and pediatric rehab. And then in about the year 2000, I relocated down here. Heard about the Shepherd Center through patients that I had in New York, and took a job there. I originally worked in our outpatient urology and wound clinic, and I started in 2002. And from there, just looking to move around, ended up in the MS clinic, and I've been there ever since.
Cool.
Yeah.
Well, let's dive right in. We're so grateful to have your knowledge and insight. Most people meet a nurse before they meet a specialist. What
Mhm.
role do nurses play in helping someone navigate MS or lupus diagnosis, especially for Black women?
Well, a lot of times when you first come to the doctor, I know it's a scary time, especially, when you're hit with a diagnosis that, you may not have even heard the words MS or lupus before, and, you're really nervous. So my role and the role of the nurses that I work with is really to try to ease you into that initial conversation with your doctor, just to kind of break the ice a little bit, make you feel comfortable, and to get you prepared for that visit. So I like to just kind of, share a little bit of myself with the patients, kind of get a little bit of their history and background, what they know, what they may have heard, read on Google or whatever, alleviate any fears. Um, those first visits usually come with a grip of blood, labs and things like that. So just try to calm that fear. I've gained the nickname of the vein whisperer over at Shepherd. So just to kind of assure them that I'll do the best that I can to not, make this situation any more intense than it already is.
That's awesome. What do nurses see in the day-to-day reality of chronic illness that doctors often miss in a 15-minute appointment?
A lot of times they don't really see, and especially for women, all that we carry. And Black women in particular, because I hate to say that we carry a chip on our shoulder, but we really do because we shoulder a lot. Being a wife or a partner, being a mother, being a caregiver to, maybe aging parents or whatever the case may be. We, as women, we do carry a lot. And I don't think the doctors, kind of realize how much we do deal with on top of now having to navigate a whole new different life with this disease that has no cure and you
Mhm.
don't know how it'll affect you, day to day.
Yeah. And from where you sit, what's the most common thing you wish patients understood about their own condition that no one ever sat down and explained to them?
Basically, it's kind of cliche-ish, but you have MS, but MS doesn't have you. Like
Hmm.
you can have such a fulfilled life with, this disease, and to not think that, your life is over just because you've been handed this diagnosis. We have, a lot of tools and resources that can help you to live a very long and fulfilling life.
Yes, I can attest to that. Thriving, I mean, in spite of.
Yeah, yeah.
Yeah, so let's get into like recognizing what's happening within our bodies. So both conditions, MS and lupus, overlap with so many other things. There's thyroid issues, anemia, anxiety, perimenopause. How do you help patients tell the difference between my condition is flaring and something else is going on?
So, one thing that I really suggest is that you get comfortable with your own body and know what your kind of normal like feels like. And especially if you also have any other kind of comorbidities and understanding what, those situations, may feel like. Like if you have high blood pressure, for instance, and you get a certain type of headache, knowing that, oh, I usually feel this way when my blood pressure is high versus, oh my gosh, is this an MS flare? So kind of getting, learning your own body, first of all, and then also just take notes. Take
Yeah.
notes of, different changes that you may feel, see, how often they occur, the how how intense, it may be, and just keep a diary so that
Hmm.
when you do go to your appointment, you can bring this up and say, hey, I've been feeling this lately. I'm not sure. Can you help me navigate if this is MS or if it's something else? Because a lot of times when you go to the emergency room or you go to your PCP, they want to throw everything on MS, and then and that might not be the case.
Hmm.
So if you kind of can know what your normal body feels like, that helps a lot.
And plus one to that, my cell phone, the notes app on my cell phone is just full of just random notes like, oh, numbness at 2 o'clock. Like, what is going on? It lasted this long. And so I just, for peace of mind, just to track any trends that might be, any like new
Correct.
signs and stuff like that, it's been a game changer to like also to calm me down a little bit too, because I'm like, okay, this is normal. This is
Right,
your day to day. It's just life with a chronic illness.
right.
Um, and then what's a symptom you want every chronically ill patient to know, to call about immediately? Like this, don't wait till it progresses. Like what's a symptom that it, you might try to downplay, but it's really like you should go see a doctor.
For me, the major thing that I tell patients is don't play with your vision. If you're starting to have any kind of eye pain, double vision, things of that nature, you want to get it checked out immediately, because the last thing you want is to end up losing your vision. I know for myself, not having a chronic illness, but I have glaucoma.
Mhm.
And when I went for just a normal eye exam, and the doctor had asked me, has anyone ever mentioned that word to you? And I was like, no. And he asked me about, any kind of pain. And I was like, well, yeah, here and there, but I just kind of attribute it to, just normal eye strain. And it turns out that I had the worst type of glaucoma there was. So
Wow.
just kind of keeping a mental note of things, but I'm big on vision, especially because I know that I could have lost mine.
Oh, wow. Well, grateful that you didn't. My goodness. We have a question from the chat.
Okay.
Um, So they are on a specific therapy and they are experiencing side effects like fatigue, weakness, and dizziness since a couple of weeks already. Um, what do you know if there's anything they can do to help with those side effects to help them feel better?
Um, Generally, maybe tweaking the dosage. Um, that probably would be the first line. It's kind of hard to say, but one of the things would be to maybe adjust dosages,
Yeah,
because without knowing what the medication is or what type, sometimes a certain dose might be too high for a person, even though it is the standard, and just adjusting it might help.
good call. And also call your doctor, your
Right.
neurologist, your rheumatologist, your primary person treating your chronic illness because they will
They're the
be
ones
able to
that will
help.
know.
Yeah, they're able to assess that. So let's get into what the day-to-day management of lupus and MS looks like. What does effective day-to-day management look like beyond just like, the usual take your meds and make sure you rest?
Right. So basically living your life, and you want to live a healthy life. You want to keep your diet in check. I think the buzzword nowadays has been gut health, but it is so true, because so much of um, our lives are lived through the bacteria in our gut, and that's what helps to keep us healthy and thriving. So having a good diet, having a good exercise routine, having a good sleep hygiene. I know firsthand what poor sleep and stress can do to your body. It's not fun.
Mhm.
um and don't It's easy for me to say, being on this side of the coin, but try not to stress too much about just the disease process, because it's gonna be what it's gonna be, and we have, tools to hopefully decrease um decrease the side effects and the things that you go through on a regular basis. But you want to focus on being as healthy as you can, so that your body is functional and able to deal with, life's daily stressors, just all of your day-to-day stuff.
Good, good stuff. We have another question from the audience. Tanya's asking, what if no one finds anything? You mentioned don't play with your eyesight. So she's
Mhm.
asking, what if no one finds anything after checking your sight, including a neuro ophthalmologist? What would you recommend after that?
Um, I mean, that's a question for a physician. There are certain tests that can be done, to make sure that the nerve of the eye is healthy, because that's what causes the problem when there's nerve damage to when there's damage to the optic nerve. That's what generally cause the problems that lead to blindness. So that's the in-depth testing that can be done to make sure that the eye is healthy. Um, and then when everything on the surface looks good, we can go into maybe some steroids, something to kind of alleviate any kind of inflammation that might be going on. A lot of times when we have patients come in with complaints of any kind of eye issues, we will start them on some steroids because there could be some underlying inflammation going on, and we just want to get that knocked out. We don't
Yeah.
like to throw steroids at everything, but vision
Mhm.
is one thing that we do.
Okay. Thank you for that. Fatigue is the number one complaint we often hear from both lupus and MS patients, and it's the
Mhm.
most poorly understood by people who don't have it. So, what actually helps fatigue, if anything?
I would say first off, and I learned this from a friend of mine who has, well, she had MS, she's now deceased, but when she allowed herself to acknowledge that she was tired because she felt like she had to be, the super mom, the super exec, and she felt like if she didn't do that, she would be looked upon as being lazy. But once she said that the diagnosis actually allowed her to breathe and give her permission to feel. And when
Hmm.
she acknowledged, like, you know what, I am really tired, and it's not that, I'm just being lazy. That was like a major key for her.
Yeah.
But we have to also understand that the fatigue could be coming from two different angles. There's fatigue which is called primary fatigue, which is caused by the brain being overloaded trying to get all these signals past the damaged areas on the myelin. And so that in and of itself will cause a lot of fatigue because of the damage. But
Mm.
then you also have fatigue, which is secondary, which is caused by symptoms. So let's say somebody has bladder issues and they're up and down during the night, to go to the bathroom and they're not getting a full night's sleep, or they have restless leg or a lot of muscle spasms and they're not able to really sleep a good full night and you wake up feeling tired. So we have to kind of figure out where the fatigue is coming from. So then we know how to, what to throw at it. And so for symptomatic, the secondary type of fatigue, which is kind of easier to treat, you manage the bladder, you manage, the spasms. Exercise is
Hmm.
a great cure, well, not cure, but a great help with fatigue. Because you think, you go to you're dragging yourself into the gym and you're so tired, like, how am I supposed to exercise? And you leave feeling like $1 million because you get that energy boost. Diet is another thing that really helps because if you're eating poor and you're not feeding your body good nutrition, that's not going to help you either.
Yeah. Um, Those are all good things. I want to plus one to working out. I have a personal trainer and I do not want to go. I'm like, I paid this money. It's fine. He can keep it. But when I tell you I come out and I just feel, first of all, my mood is elevated. I'm happier. I feel like I'm ready to take on the day. Even my husband will be like, you got to keep working out with your trainer because you
It's
are
that
like,
serotonin boost.
yeah, you're in such a good mood when you leave the gym.
Yeah.
It sounds counterintuitive, but it works. Take it from me. Um,
Well, can I add one other thing?
yes, absolutely.
Also, prioritize your day. Like when you get up, and if that is your most energized time of the day, all your heavy hitting activities, try to stack those like early in the day when you have the most energy.
Yeah.
Um, and then, as your day goes on and the fatigue, starts to set in, you can kind of prioritize, okay, then what needs to come next. Just kind of stack your day, knowing what's important while you have the energy, and then move from there.
Okay. And I see a question in the chat from Wendy, a couple. Um, can you give resources for good gut diet?
Mm. A nutritionist would probably be the
Yeah.
better person to answer that. Probiotics are always, a good thing. Natural probiotics, something like believe it or not, sauerkraut or
Mm,
something called kimchi is really good for the gut. Fermented foods are good for the gut. Um, Fruits and vegetables always.
mhm.
Um, yeah, but a nutritionist would be able to give you a more detailed kind of idea.
And then there's another question. I feel like this might be better suited for a rheumatologist, but it was asking with lupus nephritis, how much does keeping a low protein diet really matter?
Yeah, that part I'm not sure.
Yeah. Okay. All right, let's keep it moving. So pain, brain fog, flares all require different strategies. Um, how do you help patients build a toolkit for each instead of a generic wellness plan? Like if they're specifically saying like my brain fog is really bad, like how do you help them hone in on the specifics?
Um, that's a good question. Just trying to kind of again keep notes as to knowing like what's going on. Speech therapy is really good with helping with brain fog and cognition. Um, Doing a lot of puzzles and as a um, senior woman, I deal with brain fog all the time. It is very annoying. And so a lot of times I have to just write myself notes
Hmm.
because that really helps just in daily life, not even just like for appointments and things. At home, we keep a family calendar so that I can kind of just remember things that need to be done or you know try to keep things in check from a cognitive standpoint.
Yeah, good. And I see another question in the chat. Um, Kimberly says, I was working out, treadmill, Pilates, aerobics, but it took me forever to get over pain. Doc said it could be my age or the MS. Can you exercise too much or does it vary?
You can overstress yourself and you have to listen to your body. S- and when it's telling you, hey, I think I've had a little too much, then you have to know how to pull back. Stretching is really good because that helps with a lot of joint pain and helps to ease you into exercise. Um, but again, and listening to your body is definitely key.
Yeah, for sure. You gotta, if your body's saying slow down, rest, do it because you don't want to end up in the hospital. Not saying it will
Exactly.
always go there, but we tend to just, oh, we can push through and then we end up worse. And so just listen to
Correct.
your body, give yourself grace, all that good stuff.
Because it can always be put onto tomorrow's workout. And then you can modify your workouts. Like for instance, if you're into yoga and you can't really get down on the floor and do the poses, there's chair yoga,
Mhm.
there's chair tai chi, I believe. So there's lots of ways that you can modify so that you can still be active but just not wear yourself out.
Yeah. And don't feel ashamed or less than when you
Oh,
do, because listen,
absolutely.
it is quite all right. It is okay.
It is.
Yeah. What's a small habit, maybe something that takes like 5 minutes a day that you've seen genuinely change the quality of life for your patients?
Positive self-talk, um, and affirmations.
Hmm.
Um, because as women, we all get down on ourselves
Hmm.
for one reason or another. But what you speak to yourself literally speaks volumes. And you always want to, give yourself grace and give yourself a pat on the back just for the little things. You may not have been able to climb Mount Everest, but you could get, halfway up maybe Kennesaw Mountain. And give yourself credit for the little things.
Yeah.
Um,
Symptom tracking gets recommended a lot, but we're not often told exactly how to do it well. what should we actually be writing down and how do we use it?
Yeah, so just writing down what the symptom is, when you noticed it, if it's something new, or if it's an old or a symptom that you've had or chronically have, but it just starts to feel different, or feels more intense, or it just seems like it's lingering for longer. You want to also take note of how long it's lasting. When was the last time you felt, this symptom? Because what we use to treat flares or exacerbations is it has to be a new or lingering symptom separated by at least 30 days. Because it could be, if you had what you consider a flare, let's say yesterday, and then next week, um, you're still feeling the same thing and you're thinking it's something new. It may be still lingering on and it hasn't fully, recovered yet. So we want to give a good amount of time in between to know that this is okay, something brand new that's different. So a new or worsening symptom longer than 30 days. Um, and just kind of keep track of the intensity of it. Um, if anything helps, if anything makes it worse. So this way we can kind of figure out what's going on and what would be the best approach to trying to fix it.
That's good. I see another question in the comments from Tam. As I age with lupus, the mornings are the worst part of my day. How can I get more energy in the mornings? I can no longer work out in the mornings, but do tai chi.
Um, well, if the mornings are your worst time, then I would say use the mornings as your rest time.
Hmm.
Try to, sleep a little longer if you can, or just do, some kind of meditation or relaxation, type of things. Um, and then as your energy starts to peak, maybe later in the day, you can, shift your workout routine or whatever heavy hitting activities that you have for that day to later in the evening.
That's a good idea. Simple things. I mean, we're living it and it's like, oh, that makes sense. So yeah, I'm glad that you asked that because I'm sure someone else was thinking the same thing. Um, and please, by all means, put questions in the comments. There's a Q&A box as well. So please feel free to ask your questions. Get the most out of this. Okay, so on to medication, side effects, and the stuff no one tells you. What do you wish patients understood about their medications that doesn't get explained in the discharge conversation?
Well, your medications are not going to work if you don't take them. And that's a big thing that I tell my patients. So when they come in, and let's say it's somebody who was newly diagnosed, and generally, the doctor will say, here's 5 pamphlets, go home, read them, and then we'll come back and discuss it when your labs come back or whatever, and you're sitting there like, what?
Hmm.
So when you think about medication and because this is something that you probably will have to take lifelong, you have to think about what it is that you're going to be able to be compliant with. Because if you can't be compliant, it it makes no sense for you to start the medication. So that's a biggie. If you're one of our nurse practitioners, he always, when he checks compliance with meds, he always asks, well, how many pills are you missing a week? Instead of how, you're like, are you taking your meds? And yeah. And then, are you taking them every day? Yeah. Well, instead, he reverses it and he was like, well, how many are you missing? It's
Hmm.
like, oh, because if you're missing more than, what you should be taking, then of course it's not going to work for you.
Right. And that's something you should factor in, like if you are not a good pill taker, maybe an infusion is better for you or an
Correct.
injectable or vice versa. If you hate needles, maybe,
Correct.
you just have to factor in your lifestyle and what you as a person like and don't like. So,
Right. And if
yeah.
there are things that you know are going to prevent you from being able to stay compliant, let's say, for instance, like you talked about an infusion, and you have a job where you have to travel all the time and you can't, be there
Mm-hmm.
for your appointments, that's not, going to help you. So you have to think about your lifestyle, how the medication is going to fit in your lifestyle, not, you having to totally, uproot yourself to make a medication work for you.
Yeah, that's good.
But that's big. If you're not compliant, then we really can't help.
Yeah. Oh, side effects can be worse than the symptoms sometimes. When should
Yeah.
someone push their care team to switch, and how do they have that conversation without being labeled non-compliant?
Um, so when the side effects disrupt your daily life and you're just not going to take the medication, then that's the time to say, hey, like I'm not trying to be a problem, but this medicine is really making me sick and I just can't take it. Can we look at, another option? Is maybe decreasing the dose something that we can talk about? Um, because the way it stands now, this is making me feel worse than my disease. So
Hmm.
how do we, come to a happy medium? And
And
that's how I would, address it.
and then the non-compliant part, like I feel like Black women are stigmatized as being difficult when we're not. We're just
Right.
advocating for ourselves, right? So how do we broach that conversation knowing that, it we might be perceived a certain way?
Um, just being straightforward and explaining, hey, it's not that I am trying to be difficult or that I don't want to, take the medicine, but it's really making me ill. And in order for me to get better, I know I need to be on something. So how can we make this, how can we make this work?
Yeah. And we talked about it a little bit, but like adhering to the medicine, adherence is a loaded word.
Mhm.
What gets in the way of people taking their medications, and what's the nurse's perspective on what actually helps people to stay on track with their medicine?
Well, again, side effects are a big thing, because if it doesn't make you feel good, you're not going to want to take it. Um, some people forget, so if they're having, cognitive issues or memory issues, and they can't remember to take a pill twice a day or, things like that. Um, Keeping some kind of tab where you have an alarm set in your phone. I know everybody has, the little pill boxes, with the labels, but something that would help you just kind of stay on track.
Okay. Let's see. Black women often have different responses to medications and higher rates of comorbidities. How should we be tracking and communicating that with our care teams?
Um, Again, just noticing, your body and what's different, what you may be experiencing that you didn't experience before, you started taking the medication. Um, is note taking, is huge, because you have to have some way to stay on track with what's going on with you and be able to bring that, to your provider and have it, somewhat orderly so that they can see what's going on with you and try to come up with a better game plan.
Okay, on to advocacy care teams and communicating what you need. How do you coach patients to communicate symptoms clearly and concisely, especially when they only have a few minutes with the provider?
So basically, when you prepare for your appointment, you want to, um, make a list and you want to prioritize those things that are most important to you, so that when you go into your visit, you're able to, make the most of your time with your provider. Also, if they allow you to record,
Hmm.
that's helpful. Bringing someone with you to help you stay on track and remember, those top key things that you want to get across in that particular visit, because sometimes it might be 3, 6 months in between visits. Also, what might be helpful is if you have access to your, well, my chart, you can send notes or request to your provider through my chart, in the on the in-between time, and that can kind of help with questions that you may have forgotten. Because I know there's been times when I've walked out of an appointment, it's like, dang, that was on my mind at home, and we got into conversation about everything except the visit, and I forgot to forgot to ask.
That's the worst. And you're like, now I have to wait another 6 months. Uh,
Right.
yeah. Um, what question should every lupus or MS patient be asking their nursing team at every visit?
Um, I would say, um, just wanting to know if um if they're still stable, especially, if it was a visit that was attached to any kind of testing, labs or MRIs. Just wanting to, are we staying the course, making sure that, everything looks good still on the MRI, that there's no progression, or, also with lupus. And um knowing that I'm not going backwards.
Yeah. I see the chat is active. Carol
Okay.
says, I'm having the worst luck neurologist for my care here in Georgia. Sorry to hear that.
Yeah.
If anyone is in Georgia, please, drop in the chat your neurologist if you like them, and maybe Carol can get plugged in. We also on our website have a Black Doctor directory. And so you can peruse that, and we definitely have providers in Georgia. And, I don't know where you go, but Wanda is at Shepherd Center in Atlanta, and so it's a center of excellence for multiple sclerosis. So check them out as well. Hopefully, you weren't saying your neurologist is from there.
I hope not.
Yeah. And then Claudette, you said you had to get an app. You had to get an app for what? Please share all the tools and tricks because we need
Oh,
to,
that would be very
yeah, we
helpful.
need to know as well. So was it an app for like managing like energy, or what was the app for? We'd love to know. Oh, to remind you to take meds. Yes.
Oh,
Thank you for your prompt response. Yeah, I have my specific DMT has an app, and so I just like get alerts and stuff, thankfully, to remind me to take my medicine.
yeah.
Um,
Alarms or anything that, will trigger you to remember is great. And, also having a person, a caregiver or somebody there to help remind you is also a good thing too.
yes. And someone put in the Q&A, hey Latoya girl, Dr. Mitzi Williams. So we love her deep. She's a former board member. She has been great for the We Are Ill community. So I don't see her, but I know that she um, sees Black patients. She has her own practice.
Mhm.
And yeah, she's highly recommended by many people. Everyone's, experience is different, but yeah. You can find the Black Doctor list on our website. It's in the resources tab. But I'll drop it in the chat in a second. Um, let's see. There's some more questions. What is a good way to find a doctor who offers medical messages for Sjogren's lupus regarding joint pain? I don't know if we can answer that because
Yeah, I'm not sure
yeah,
about that one.
sorry. I think for sure you would want to see a
Oh,
rheumatologist.
yes.
Yeah, for that. Um, Tara says Care for Today is a great medicine reminder app. Thank you for that. And now I wonder, is that universal regardless of illness? Um,
I
my
did
question.
see somebody say that their specialty pharmacy um, alerts them to or gives them a call when it's time because they have to ship the medication out. So that's
Hmm.
also um, that's a good resource.
Yeah. All righty. And keep them coming. Keep the questions coming in the comments in the chat. So how do nurses, neurologists, rheumatologists, and primary care providers ideally work together? What do we do when that coordination breaks down? So we have a care team. We see our primary, we see, our gynecologists, we're women. We see our, our specialists. So how ideally should they all be working together, and what do we do when things get out of whack?
Well, yep, teamwork does make the dream work for sure. And a lot of doctors will use some kind of integrative care model where they're sharing notes, they're sharing imaging amongst each other, especially if there a major issue happens with the patient. So hopefully, um, if they don't have a medical record system that connects with each other, that they're at least having their nurse fax over notes to the office so that each discipline is aware of what's going on with the patient. And then, if necessary, you can take it upon yourself to ask for your medical records to make sure that, your physician, like if you need your neurologist to communicate better with your PCP, asking for your records so that you can, have them sent. But in today's world with electronic medical records, it makes it a little bit easier for that to happen because you can see across practices all the notes.
Good. What does culturally competent nursing care actually look like in practice, and how do we ask for it without feeling like we're being difficult?
Just being aware that we all have different backgrounds, different cultures, different belief systems, different religious beliefs, different cultural beliefs, and to number one, above all things, to be respectful of that. And to, you may want to ask a person, as you're being mindful of these things, like ask them how they would like to be addressed.
Hmm.
Some people may not want to be addressed by their first name. They may want to be called, like, especially if it's an elder, they may want to be called Mr. or Mrs. Or, in some cultures, it's kind of not okay for the woman to speak, and her partner may have to, speak for her. And yes, you want to hear from the patient, but if that's not how it works in their culture, you have to be, respectful of that. Um, and just having a deeper, understanding and knowing how you yourself, want to be treated. Um, like I know how I would want to be treated in a visit, and to always make sure that I extend that same courtesy, to my patients, and not just because I'm the nurse and I say so, or because, the doctor says, well, this is how, you know, I practice and this is how it has to be done. You have to take into consideration the other person's, values and lifestyle, because if they feel disrespected, then they're not going to want to talk to you and share. And then, you have that breakdown
Yeah,
between the doctor-patient relationship.
good. I see a comment or a question. Um, Perhaps you can answer this, maybe. Tams is asking, there's a shortage of Black patients in medical studies, and a lot of the findings don't work well for us. What can be done to increase our involvement in medical studies? I'll start by saying We Are Ill will partner with various, pharma partners who want to, get more participants and more diverse participants in their clinical trials. And
Hmm.
so be on the lookout for those emails. If you're not on our mailing list, please join, because we do want our community to be engaged and aware of the different studies out there. That I know that our community does want to participate in studies. So it just starts by just being aware of the different options that are out there for us. So we're a resource. I know there's clinicaltrials.gov. Um, Anything else you would like to add, Wanda?
Well, at Shepherd, we have a clinical research department, and I work very closely with them as well. And we have one of our investigators who is a young Black woman who is heavily invested in bringing studies, for our culture. And our new medical director, I'd like to toot that horn, Dr. Jacqueline Rosenthal.
Yay!
She is
Love her.
very involved in research and especially with, with our people. So just asking, you
Yeah.
know, um, Google searches are good, but uh, asking at your doctor's office if there are any, if they know of any studies or if they are hosting any studies. Your organization, like you said, is a great resource. But we kind of have to, unfortunately, go out and seek
Hmm.
because it's not always going to come to us.
Yeah.
Um,
Yeah. Okay, so I'm just looking at the chat and we're winding down on time. So if you ladies have questions, please feel free to drop them in the chat or in the Q&A box. Don't leave here without your question being answered. Uh, Lynn says, I'm a Q&A girl with my neuro, so Dr. Tar will sit even for an hour and answer every question, go through every layer of my MRI and biomarker studies. I love that for you. That
mhm.
is not the
That's
case
not the norm.
with a lot of us, so hold on tightly to Dr. Tar because that's a
It's
good one.
unfortunate that the way healthcare is now is so driven by time and money and productivity.
Hmm.
And the doctors like they have to document, exactly how many minutes were spent, in the conversation, and it has to be, X amount of minutes devoted to, this. And before you know it, you may have gotten one question out because they have
Hmm.
to, stick to their agenda.
Hmm.
Um, and it is sad that, we can't have a conversation with our doctor, like this young lady who can get every single question, answered.
Yeah. Bless you, Lynn. If only we could be God's favorite, just like
Right.
you. Let's see. Um, Karen Williams, my neurologist at Shepherd, is leaving. Praying the next neurologist is as good. I hope so too for you, but Shepherd is a great facility, so
And
you're in good
she
hands.
is,
Yes,
I will
she
say that
confirmed
she,
it. That's great. So you can rest assured. Tara says, when I go to any of my doctors, PA or practitioners, I always have a notebook with a list of concerns on everything that has happened to me before the visit. My doctors have always answered everything, pretty much always have a checklist. Yes, I agree. And like Wanda mentioned, like prioritize, because you
correct,
might want to run out of time. So ask the most pressing questions
first.
first.
Hmm.
I was in a study for 6 years and was the only Black patient. That's wild. That is wild.
Yeah.
Um, let's see.
We
Shout out to,
recently had a study, I think it's closed now, it finally closed, but it was specifically for Black and Latino
mm,
patients, which was a first.
yeah, that's great. Um, Shout out to Dr. Ben Thrower. I assume
Uh,
he's a, is that the one
he-
who retired?
he's retiring,
Oh,
yes.
okay. Shout out to Dr. Ben Thrower. Um, OMRF is a good facility for studies, research, and clinical trials with lupus and MS and OKC. Thank you for sharing that. Alrighty, so we're winding down. Please, please, please ask your questions, but I have some closing questions for our good friend Wanda. What's one thing you'd say to a Black woman who was just diagnosed today, something that would have made your patient's journeys easier if they'd heard it on day one?
Um, just know that you have a second family. at least at Shepherd Center, I can say that you have a second family, that we are here for you. We're your resources for you. If you need to cry, cry, because sometimes a good cry will help a lot of things. Um, if you're, a faith person, you know, talk it out with God, but understand that this does not have to be your whole life story. Um, and just understand that with um, a good plan, a good medical team, that things could be great. I've been to so many weddings. I've seen so many babies, born, from women who thought, "Oh my God, I have MS. My life is never going to be the same." And now you're married with two kids.
Yeah.
Or thinking that nobody's ever going to want me, or those type of things. You have to get those negative thoughts out of your head, because this is just one piece of your life. It's not your whole life.
Hmm.
Your life is what you make of it.
Yeah. Very true. It's the ball's in your court when it comes to, yes, you have a chronic illness. Yes, there isn't a cure yet, but you can still live well, and it's up to you to, not let your illness stop you. If you want to
Correct.
travel, go travel. If you want to skydive, just get out there and do it while you are still able. Literally nothing is holding you back except for, sometimes your body will hold you back. You know how
Right.
it is. But like, no one is saying Ashley was diagnosed with MS. She can no longer do X, Y, and Z. So just,
Correct.
just continue to prioritize joy.
I
So
had a
those,
patient who was when I met her, she was in a really, down period in her life. She was, just depressed and everything from her diagnosis. She had ended up gaining a lot of weight just because she stayed in depression so long. But then she, picked herself up by the bootstraps. She, started working out, got healthy. This woman ended up being a national level powerlifter. And
wow,
powerlifters lift lots.
lots.
Yes. So, I mean, it's possible.
That's
And now she's
amazing.
happily married.
That's
So
amazing.
it's all in what your thought processes are, how your mindset is. And yes, it's easier said than done, but try not to let so much negativity,
Hmm.
seep in. There are bad days. You're gonna
Hmm.
feel like crap some days, but just know that tomorrow can be a better day.
Yes. Take it one day at a time.
Exactly.
Um, well, we covered all the questions. Unless you all have a pressing one, you can get it in, or if you want to come off mute and ask it really quickly. But we are about to wrap. A couple of shameless plugs. If you are craving community, We Are Ill is here for you. And so we have a private Facebook group. And we also have our Beyond Ill membership. And so it's a private space off of social media, hosted on a completely separate platform, but it's a place where you can have chats like these, ask questions of your fellow chronic ill girlies, and we have bi-weekly chats. We have just things that chats in. Oh, thank you for joining, Carol. I thought your name looked familiar. Um, so Carol just joined today, and so yeah, it's a place where we just have conversations. It's not all about, just, oh, we're sick, it sucks. We talk about, the latest trends, the movies that we're watching, the meals that we're cooking. We do life together in there. So I would highly encourage you. The platform is beyondill.mightynetworks.mn, .com. I'm typing it in the chat. .co. Um, I added a space, but all one word, beyondill.mn.co. And then we have our annual wellness weekend. It's taking place October 30th to November 1st in Atlanta, Georgia. So it is a time unlike any other. It is a blast. So you will have a good time. Even if you don't have anyone to come alone and you will leave with friends for life. I know Latoya can attest to that. A lot of people who have been to Wellness Weekend find it helpful. So tickets are on sale for that as well. You can go to our website, weareill.org, and you can also just go straight to the website for Wellness Weekend, which is wearewellnessweekend.com. So yeah, it's a time. We have happy hours, we have adaptive fitness, we have support groups. So come get what you need. Even better reason for you to come. Let's celebrate you, Carol. So yeah, thank you all so much. Again, there will be a recording, so if you miss anything, you want to brush up on anything, look out for that email. And so I if no one else has any other questions, I'll close out.
I
Um,
just wanted to add to what you said. Another thing that would be, just great as a stress reliever, because we know how stress loves to just come and wreak havoc in our lives. And you talking about, the We Are Ill events, girlfriend time.
mhm.
That is like probably one of the best stress relievers that you can have, just to be able to sit and like you said, not talk about being sick, but just having an adult slumber party, just having that one-on-one time, with your friends where you could just chill and relax and kind of, forget about everything else.
Yeah. I love a good gab fest with my friends, or just even, we don't even have to be talking. I'm just sitting on the couch
Right.
eating or having a glass of wine, or, just something about just being in the presence of friends and loved ones. It's a game changer. So get out there, talk it up with your girls.
Hmm.
It'll do a lot for your mental health.
It definitely will.
Alrighty, well, this has been so good. Thank you so much, Wanda. Before we close out, two quick important things. We have a post event survey, and we would love for you to take it. It's just a way for us to, get a better understanding of how this landed for you, anything that we could be doing to make your experience better. So we just dropped it in the chat. It's right there, and you have a chance to win a $40 gift card. So we'll be raffling that off. So please do take it. It will not take you long at all. And then make sure you come back for our next and final session, Ask the Case Manager with Wendy Williams. She was in the chat earlier. So yeah, it's we're going to close out the week with, tips on how to navigate the system, sorry. So yeah, same link, same time. Bring your questions, bring a friend, and let's keep the conversation going. Thank you all so much and have a good
Thank
rest
you
of
for
your
having
day.
me.
Yeah, we appreciate you, Wanda.